All right, here we go. We're live. Obviously, I said 5 o'clock. Listen to a little bit of music, enjoy, and I'll be back. Tag some people. Hi guys, I'm going to give it like 5 minutes for everybody to trickle in before we start the conversation. If you guys have questions, things you haven't thought of, feel free to put them in the comments. So a couple minutes, enjoy my music. I hope it's a little bit relaxing for everybody. I try to pick something, calm everyone's anxiety down. So hi, I love you. I have to skate 2 or 3 minutes. I'll be right back and enjoy the music, and I'll be back when we get started. All in my mouth, only I don't know how they got out to turn me back into the past. I was when we met, I was happier then with no mindset. And if you turn to the side, girl next to me, I'd jump. For those of you guys coming in, thanks, Colby. For those of you guys coming in right now, we're going to give a couple minutes for people to trickle in. Then we're going to get started. We do the boring stuff first, which is my disclaimers, some of the basic things, saying hi, and then we'll get into the meat and potatoes that everybody's looking for. I need to learn how to do like the Kramer entrance, but people are yelling at me already. Hi everyone. Oh, I've got some people I haven't seen for a long time. I'm glad to see you guys here. I assume everyone can see me okay. I know it's a little bit, I'm using my phone this time, so it's a little different. Everyone can hear me okay, right? Or you can hear the song, so. Alright, I'm going to take that as a yes. Is everyone relaxing to the music? I hope so. I'm still a white boy, I can't really dance, so. Good. Thanks, guys. All right. A couple minutes. You guys ready to get started? Get this show on the road? Thanks, Beth. All right. No more music. If you want it back, we can get it back. Just kidding. I mean, I gotta talk. All right. Hi, guys. Hello. Welcome. As people trickle in, I hope friends, family, if you get a chance, share this while it's going up. Trying to share information. Frankly, it's probably a lot of stuff people already know at this point. I think the news and everything on Facebook is pretty saturated with... Thanks, Kevin. Pretty saturated with information that's coming out with coronavirus. There's a lot of things out there. I'll try to give my perspective. I expect this to not be as long as some of the other videos, but I do have a caveat at the end. If you guys are tuning in now, keep in mind, we're going to talk about some pretty serious topics sort of the end of this video. And then as soon as I'm done with this, what I'm going to do is I actually have a YouTube video that I'm going to be putting together that I want everyone to check out. It's about end-of-life decisions, the difficult conversations that we need to have as physicians and people about what do we do if we're super sick, if people are dying, what's the process, what do we as physicians do for that? So that's going to come afterwards, and we're going to deal with that. So keep in mind, every time I've done this, I've been on a bit of a delay. So if you put a question there and you're seeing it takes me a while, that's usually why. Put it out there. But hi, everybody. I love you. I hope everyone's safe and healthy. Make sure everyone's staying strong, doing their best to stay fit and stay sane. Sanity is a very important thing during this time, right? So, all right. So if anybody's on here that doesn't know me, my name is Dr. Mark Wiseman. I am a practicing emergency medicine physician. I am an attending. I am almost board certified. They pushed back my oral boards by a couple months. So when that is done, I will be board certified. I currently I've practiced in Missouri, Arizona, and California. I move all over the place. I'm a traveling physician, currently pretty significant interest in critical care, trauma, and then education, which is why I'm here. So I hope everybody gets some education out of this. As always, with the start of these, I need to put out a disclaimer, right? So everything I say here is from my own opinion. Nothing represents any organization, hospital, none of the big organizations, emergency medicine. It's me, it's my experience, and it's me trying to share information with you. So don't think that I represent any particular organization. Furthermore, don't take anything as specific medical advice. I legally am not allowed to give you specific medical advice. Hopefully the information I give you here today helps you make decisions that are better for you and that you can pay attention and then use to help direct your own care and take care of the ones that you care for. Also, remember, I'm an emergency medicine physician. So my job is when you come in sick and dying, or even sometimes if you're not, if you think you are, my job is to get you better. I'm not a surgeon. I am not a dermatologist. I'm certainly not a gynecologist. Speak to my mom. So there are certain things that I'm not a specialist in. So my knowledge, as with everybody's, is a bit limited. I only know what I know. I don't know what I don't know. But keep in mind that I'm coming from a certain perspective. And of course, there's going to be a little bit of inherent bias. Hi, drums. I'm so glad to see you guys here. That's awesome. All right. So let's get into some updates. We've had some questions. What's going on right now? Anything changed? And if you have basic questions, I will redirect you to my old videos that exist out back there on my page. So please keep in mind, you can go back to those at any time. If people have questions, if people haven't seen those, feel free to ask the questions here. We can retouch on that as we go. All right. So what I know right now as far as changes from before and things that you might not have heard. First and foremost, so cases seem to be rising in the United States. Congratulations, United States, we're number one. Woo! We currently have the number one amount of cases. Now, everybody's going to ask, the inherent question is, why is that? Some of that comes from the fact that we've ramped up testing, right? So testing numbers have increased. We are increasing the amount of people we can test. And in fact, as of yesterday, I saw FDA approval for the 45-minute test. So that's an optimistic look. We think that we might have more rapid testing and starting to have the ability to test more and more people. And that's a big deal. So what you're going to see is the number of cases is going to grow. But hopefully, as the number of cases grows and the number of overall people the cases find out, the mortality rate is going to drop, right? So as we find out more people that aren't critically ill, have the disease and are tested positive, then the case to mortality rate is going to go down, and we're going to see that it's going to go down. I do personally expect that. I think the mortality rate is going to drop from initial projections, which is a good thing. Now, that doesn't mean I don't think we need to take this seriously. We'll talk about that a lot. We'll try to talk about what to expect. What we can say is that compared to other countries, we do need to do a better job of getting this under control. I watched a interview with Dr. Fauci today. One of the things he says, and makes sense in the United States, is we're a big country. Right now, one of the problems we have is we actually have 3 epicenters of this disease. Basically, Los Angeles, New York City, and then down in New Orleans. My friend Kevin's down there in the epicenter. He's getting slammed by it. He can tell you first-person perspective that this is actually getting pretty serious. I've seen a couple reports from down there in New Orleans, and it's kind of scary. I'll take that back. It's really scary. For me as an emergency medicine physician, some of the things people are seeing is pretty out there. I can say that Kevin told me last night he was on shift outside of New Orleans, not even in the middle of it, and he believed he had to intubate 5 people, so put 5 people on life support, when typically doing that once or twice a shift is common. So that's a significant change. It's something to be paying attention to, and something that we really need to be mindful of this as it goes. I think we can expect the caseload to go up. What to do about it is a different conversation. We are working right now trying to figure out how to close things down. Quarantines are getting the conversations about those, whether those are going to make a difference. We're definitely going to see that. So rates are going to go up. So something else to keep in mind is when you're talking about a disease like this, something we are trying to wrap our head around is when you have an infection like this, so every person that gets it, we expect to infect with no other intervention is going to infect 2 other people. So that means what we worry about is an exponential increase. So the difference with that is if you have a normal increase, that means 100 people a day get the disease. It progresses, it kind of goes linear. Problem with a virus like this is for every person that has it, if they give it to 2 other people or more, they expect it to double. So we're looking at it, an exponential increase. So it increases kind of like this and kind of shoots up. So that's why you see such a sharp rise in the number of cases as testing increases, but also just through life. We expect that that exponential increase. So that's not unexpected. What we're trying to do is we're trying to curve off that line and bring it more steady to try and decrease the number of cases per day, or how much it doubles per day. Okay, another big thing we need to talk about. So the last time I spoke to you guys, we said that if you were younger, you were pretty much protected. Well, sorry, bro. It looks like we're getting more and more people that are in the younger generation. Now we're typically talking about people 30 to 40 years old who are getting pretty significantly affected by this disease, including going to the ICU, being critically ill. Still waiting on some of the data to come back on whether these people die or not. We are getting it. Obviously, there was a case, I believe it was here in LA, of a 17-year-old who didn't have insurance, was pushed from hospital to hospital, and reportedly ended up passing away. So the initial thought and the initial data that came from China that suggested that if you were younger than the age of 60 or even in your 30s or 40s that you were protected, that's kind of gone right now. We are kind of reevaluating that data to try and determine if you really are going to be more safe if you're in a younger population. Right now, I think I saw a statistic at some point that said up to 40% of the people that are critically ill are between the ages of 30 and 50. And some of the people, and a lot of the people that we're seeing in our ICUs end up being healthcare professionals. So this is something to keep in mind. We do have to further encourage people that are the younger generations to protect themselves, do that social distancing, do the quarantining that we've been harping on so much, and pay attention to what what's going on around you. Keep yourself healthy. All right. I haven't seen any questions yet. Apparently everyone is so informed from my last video that nobody has questions, which I'm going to take as a giant compliment. So we're just going to go with that. All right, so the second thing, I have got some stuff a lot of people ask. So how bad is it really? I'm going to echo Dr. Fauci on this. So everybody tries to compare this to the flu, right? So we talk about the flu and everyone's like, well, it's just like the flu, the mortality rate isn't that significant. Maybe we shouldn't be dealing with this so harshly. Maybe these quarantines are a little bit excessive. Well, even mimicking him, what he says is the flu virus, if you get the flu, has a mortality rate of about 0.1%. If you look at, even with conservative measures and take into account the fact that a lot of people who are asymptomatic aren't being tested, the reality is we can say that coronavirus probably has a mortality rate of about 1%. That means it is 10 times more deadly than influenza. If you want any further proof, just look at all the emergency departments and hospitals that are being hit so hard with this epidemic, right? So like I said before, emergency departments that are used to taking care of a variety of things are now solely focused on treating patients with coronavirus. They're talking with up to 14 intubations in a 12-hour period. So that's 14 a day. This is unheard of. This is not something that we typically deal with in the emergency department. Those rates and those people that are sick, it's rising exponentially, and we're dealing with a very serious epidemic, a serious pandemic, that people need to take really seriously. Something that I thought about, so if you think about that, so if we're at a mortality rate of about 1%, so even if you're dropping it that low, there are 330 million people in the United States. We expect about 70% of those people to get sick. 1% mortality on that is going to be about 2.2 million. I'm roughly estimating here. This is me throwing numbers. I'm not an epidemiologist. Don't take this as fact. But that's the worst case outcome, say about 2.2 million people could be affected, critically ill, and die. This is a big deal, right? So one of the things we've harped on, one of the things we've talked about in the past is what effect this will have on our medical system and our healthcare system. Our healthcare system as it exists right now simply does not have the resources to deal with this kind of pandemic and to deal with those kind of numbers. This is something we need to intervene on. We need to intervene on the ground level, you and I, doing what we can to try and prevent the spread of this, okay? Obviously, some people are taking it more seriously than others. I've been a big proponent of taking this as seriously as we possibly can, right? The big thing for you and I, right? So most people out there aren't going to be affected, right? But you're still going to have a heart attack. You're still going to have strokes. You're still going to have car accidents. If all these elderly people or people who are critically ill are taking up all of our resources, and you come in a car accident, we don't have the ability to treat you. It slows down things. That has a significant effect on your health and your outcomes when you are critically ill. All right, I'm seeing some questions here. Let's scroll through and let's see if I can answer some things. All right, Claudia asks, how much time after your fever is gone can you go back to hanging out with the roommates? So this goes back to our conversation about social distancing and quarantine. So the general recommendations, initially the recommendations were 14 days from any kind of symptom onset or exposure. Right now, the most recent things I heard were a 7+3 method. That means if you have symptoms, the minimum that you need to be quarantined is for 7 days. And then what we talk about is you want to tack on 3 days after you're symptomatic. So for example, if you have a fever, so you've quarantined for 7 days, but now you're on day 8, and you're still sick, you have a fever, you have to wait at least 3 more days before you can come out of quarantine because you can still be infecting other people with that virus. Now, they've talked about shedding that goes longer than that. We don't think that that necessarily infects other people. It can to a smaller extent, but not in the way that's significant like what we're dealing with now. So generally, you need to wait. If you have a fever or if you're sick, you need to wait 3 days asymptomatic without treatment, no Tylenol, feeling totally fine before you go out and hang with the homies or the roomies or whoever else you want to hang out with. Again, this is my white boy dancing welcome. All right, I had one other good one. Let's see. All right. Alexandra asks, if you have a heart condition, am I at high risk? If we have a pacemaker. So it's hard to say specifically. What we do know about coronavirus, and this compared to SARS, is that if you have any kind of heart issue, so coronavirus does like to target the heart. So there's evidence that the receptors on your heart have an affinity for this virus. And that means that virus is more prone to infecting things like the lungs, the kidney, the liver, and the heart. We are seeing specific kind of infections in, cardiac arrhythmias. So cardiac arrhythmia is if your heart essentially acts wonky or gets infected. We are seeing those infections specifically targeting the heart in critically ill patients. So yes, I have to say, hypertension, heart disease, you are at higher risk. In fact, if you have a pacemaker, you might be a little bit more protected. I only say protected in that if you're at home and you go into these arrhythmias, you might be better prepared. That pacemaker can help you. But yes, heart conditions at this point are expected to be a risk factor. I think I saw data that came out of China for a while ago. If I remember correctly, it said up to 80% of the people that are critically ill have a heart condition. So be mindful of that. Yeah, you have to be paying more attention to heart conditions, respiratory conditions, or if you're immunocompromised. Okay. I'm going to continue on with mine. I have a bunch of good questions there I want to answer. We're going to get to them. So a lot of people ask me, I've seen this everywhere. In fact, with the people I'm close with, we've had a lot of discussion about this, is if I'm at home, what do I do to protect myself? So a lot of people, so Dr. Kamel and I, we're the big ones who've been on live and discussing this. The big thing we're pushing is that social distancing and quarantine. People need to be aware. We're going to talk about treatments later, but there is no magic pill. There's nothing that you can do specifically if you have it to treat it. It doesn't exist. Don't believe in it yet. I'll be the first person on here being like, bam, look at this. This is great. If there is a treatment that's going to work, I will be there telling you guys. But as of yet, the best way to treat yourself, the best way to do it is to not get it in the first place, right? So social distancing, quarantining. If you have symptoms, stay away from people. One of the topics I wanted to talk about is masks. So this has actually changed a little bit since the last time we talked. So there is some conversation as whether or not getting masks and using them can help you. So what you have to know is there's no specific mask. You can't guarantee that a mask that you buy or do or anything like that, other than an N95, is going to protect you. Specifically, that's what they're offering for medical providers. I'm in a couple of forums for medical providers, physicians, PAs, nurse practitioners, what to do. Right now, they're using all N95s. There's a little bit of conversation if you wear a mask and someone who you don't think has it, is it going to protect you a little bit? So again, there is some evidence that masks in general, cloth masks, those things out there can provide some protection, a little bit. It is not going to totally protect you against coronavirus. You have to know that the size of the virus is so small that it seeps in between. Now, part of what they're finding, there is a little bit of stuff that's changed. Initially, we thought, Initially, we thought that this was aerosol infection. So that means that the minuscule microscopic moisture that comes out of your breath spreads it. There's a little bit of evidence now that that's not the case, that it has to go with the bigger droplets when you cough and project it out. So there's a little bit of evidence there that says if you prevent that from getting in you or on you, that could prevent it. So that's a little bit reassuring. That also means if you wear a mask, hand washing, pay attention of where those droplets are. If it's on a doorknob, washing your hands. That's why we've encouraged that so much. Now, cloth masks are a little bit concerning. I've seen some reports that it can hold the virus and that moisture can hold on to it. I've also seen reports that the virus doesn't like cloth. So going back to some older questions about being on cloth, anything that's porous, the virus doesn't really do well in. So long story short is that in places like China, masks is considered a common sense practice, right? Getting those things, even the cloth masks, as long as you're washing them and practicing safe hygiene otherwise, these can provide a little bit of protection, but don't go in with a false sense of security, because this can be, you can still get an infection if you're wearing the regular masks. This is a big plea. Please, for the love of God, don't go buying up all the N95 masks. Healthcare workers are in desperate need of these. Like I said, up to 20% of the people who are critically ill are healthcare workers. And it's because we are not given proper access to PPE. In fact, there's hospital systems out there who are firing people and getting the nurses in trouble for using this equipment. It's a big controversy. Check it out. There's some problems out there. Pay attention to that. So please, 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 I still see people out on the streets if I'm driving or doing something that are wearing these masks. Please don't do that. We desperately need them in the healthcare system. You really don't need them unless you're in somebody's face, like I am when I'm intubating somebody, putting a breathing tube in, doing those life-saving procedures. Those are the times that it's most important. So please be mindful of that. I'm going to do one more. I'm going to use this as a caveat, and then I'll go back to some questions. People are asking, and I'm seeing a big surge of people wanting to help us in healthcare. And I think this is admirable. One of the things that has galvanized me and made me sort of reinvigorated my faith in humanity is all of this charity and support for the healthcare workers. There are people who are out there buying those masks from people that are trying to price gouge, and then donating them to the healthcare system. You guys are heroes. If anyone out there knows someone that's doing it, you're my hero. That's what we need. Again, if you see a charity, there's organizations out there. Be mindful of how you're using protective equipment, and pay attention. There's a lot of us. There was an ER doctor that was fired yesterday for trying to promote proper protection for the employees of a hospital, trying to promote proper protection for the patients there. A lot of administration doesn't understand. They're kind of focused on a little bit of their bottom line. That's what they have to do. So we need to be big proponents. We have to be vocal and support our healthcare workers. Okay. Love you guys. Let's go into some questions. We've got a couple good ones out there. So, David, I'm going to get back to your question because we're going to talk about some treatments. He's asking about Truvada. Danelle asks, so can you be reinfected after you've had it and recovered? So right now, the short answer is no, we don't think so. So once your body develops antibodies to any particular virus or infection, we believe that you have that immunity for up to 2 to 3 years. Actually, a maximum of about 10 years. We don't really know. That immunity usually happens between 8 to 10 days. They're actually even, one of the things they've talked about is using people who have the immunity, using their blood to treat other people. So you make such a strong immunity that they can potentially use that to treat other people. So it's actually pretty reassuring. What we are concerned about is whether or not there can be other strains of the virus. We know that coronaviruses cause the common cold, and that likes to come back every year. So there is a conversation about other strains infecting people. Right now, we don't know. There's no evidence for that. I would say once you have it and you're better, I would expect you not to get it again. All right. Somebody asked me something related to that. I think somebody asked me if you get this, can't remember, if you get coronavirus, can you get flu? Can you get other viruses? So the negative to that is actually yes, right? So unfortunately, we found that coronavirus and a lot of the other viruses are so different that should you develop an immunity to coronavirus, it doesn't protect you against the flu. In fact, we're seeing something that's kind of the opposite. What we're seeing is that for those people who are infected with coronavirus, they actually have a higher likelihood to get co-infections or to get reinfected with something else. So there's a 20% co-infection rate. So if you have coronavirus, there's a 20% chance that you will also get the flu. So this means a couple things. This means that if you come in and you test positive for the flu, it does not mean that you do not have coronavirus. It means that you can have symptoms of both and feel really crappy, and you can also have it back to back. So that's the unfortunate thing to pay attention to. Just because you have the flu or flu-like symptoms does not mean that you don't have coronavirus. All right, a couple other good ones we're going to talk about. Bubba asked me, Mark, is it true that taking ibuprofen can make symptoms of the virus worse? So this was an initial scare. The answer to this is probably not. So saw another podcast by Dr. Fauci today said there's initial anecdotal reports of ibuprofen making the disease worse. That has not been corroborated by any kind of scientific backing research. There's no scientific evidence that demonstrates that ibuprofen makes the disease process worse, okay? There's some theoretical evidence, so I say if you really, really want to be extra careful, you can stick to things like Tylenol. If you're having fevers, if you're having those body aches that we talk about that you see so much with the virus, stick to Tylenol. But if you take some ibuprofen, it's not like, bam, you're dead. Be mindful, but there's no scientific backing of that. The evidence for ibuprofen, it is what it is. So no reinfection. All right. So I've had a couple of questions. Let's talk about treatments, okay? All right. So what's happening with this? So I've actually been paying close attention to this. Like I said, I'm on a couple forums on Facebook and privately looking at some of the critical care personnel, ICU doctors who are on the front lines and are treating this. Right now, I have to be prominent and say, for the general public, for you and me, do not expect any kind of significant treatment or vaccine in the foreseeable future, right? Most of the treatments are being reserved for people that are very ill or are critically ill, right? So there is the talk of hydroxychloroquine and azithromycin. From my understanding, these need to be reserved for people that are critically ill in the ICU, undergoing specific treatment, that are already intubated, on a ventilator, things like that. I've heard of them using it for celebrities, specific cases, doctors actually prescribing this. Frankly, from what I've heard, the evidence is not great that it's really going to make that much of a difference. The scientific data isn't there. This medication is typically used to treat people with things like rheumatoid arthritis, Crohn's disease, reserved for a rheumatologist. Who I have rheumatology friends who are pleading with the public and with other doctors not to be prescribing this medication because they're running out of the supplies for the people who truly need them, who there's scientific backing for. So there are some talks about antivirals. Most of those are in the early stages of experimentation and clinical trials. There's no clear evidence that it makes a difference. There are things that are coming out which might be optimistic. There's 101 studies out there which are talking about it right now. And for you and me, don't expect any clear treatment. When you talk about treatment, I think this is a good kind of segue into what's happening to people. The last I saw, even with those treatments, people need to be aware that if somebody gets this disease and they end up on a ventilator, they're critically ill, they're talking 4 to 5 people will never come off the ventilator and will die. We're changing that. There's a lot of interventions that have been put into place. These things called proning, the way we deal with a ventilator, some of the other treatments, the chloroquine. There are people that are coming off, but right now, there's no, the death rate when you're critically ill is pretty high. So there's things that we're doing. There's a little bit of optimism out there. I warn everybody to be realistic in the fact that I don't expect there to be any clear treatment within the coming weeks or months while we're being quarantined. The best thing that you can do, we're fully advocating for this. Please, please, please practice prevention over treatment. Be safe. Don't get the disease. That's the best way to keep you and your family safe. Don't count on it. Everybody's asking me, I'm seeing things on there. Oh, I did want to counter. People are talking about steroids. I had Renee actually specifically asked me this. From the data I saw, the anecdotal consensus from the intensivists, they are saying that steroids aren't helping. We treat it like ARDS. It hasn't really made a difference. The big things are proning, vent management, staying light on the fluids. This is again for medical providers. Decrease the amount of fluids. They are using some of the antibiotics and then giving it time. All right. Oh, a lot of people are asking me about supplements. There's no supplement out there that's going to cure the disease. There are supplements out there which are known to help your immune system. Whether these specifically are going to help with this virus obviously is unknown. These things aren't well studied. I'm a believer in things like vitamin D. Most of the country, we believe, is vitamin D deficient. The proper way to get this back is seriously still a controversy. We don't know. A lot of people will tell you they know. A lot of people will be completely certain. Nobody is certain. I think getting out and getting some sunlight's the best way. Obviously, that's a little bit difficult right now. Sorry. But getting a little bit of that supplement. There's some evidence that zinc has been helpful. There's a little bit of anecdotal evidence or reports about vitamin C being helpful. Now, they've used this for critically ill patients. IV, it's a totally different method. I've also heard some other, there's some studies. If you go back through my page and look through, I linked some studies about things for licorice proteins and stuff in there. There's little things that might help. Don't go crazy. taking a huge and vast sum of these supplements is not going to help you. There's no cure for the virus. I always, the best things we can do is eat healthy, get plenty of exercise, drink plenty of water, take a multivitamin, stay as healthy as you can, support that immune system, and hopefully that'll help it stave off any infections with the virus. All right, I'm going to look through some of these other questions, and then we're going to get into the meat, something I really want to talk about and harp on, and we're going to go into, and that's the hard discussion. So we're going to do that in a second. So I'll look through. If I missed you, I apologize. Put it back on there. I'm trying to go through. Let's see. Ibuprofen, we talked about that. Can be reinfected. No. Truvada. There's no evidence. We're talking it's still working. Be reinfected. All right, going back through. Oh, all right. So Jerry asked a good question. All right, so we're going to repeat that. So far, everyone that has tested positive has been hospitalized, has either passed, or is still on an event. There's only been one successful extubation thus far. Now any nursing home patient that comes will be ruled out before we can send them back. Next week is going to be bad. When do you think this will settle down? I'm thinking August. So this is another question of how long do we think this is going to last and come back? So as per my earlier things, it hasn't changed too much. The most pessimistic projections say that this could last until August, right? So with no intervention, no vaccines, anything like that, we do expect it to go for a while, and that means people getting sick. As far as the quarantines and how bad it's going to hit, I think most people right now are projecting that the worst case for the country as a whole is going to be in May. So we have some time before we see the worst of it. Now keep in mind, if we look at places like China and South Korea, each region is expected to have cases and to be hit for approximately 8 weeks or about 2 months, right? So that means in a place like New York and LA, they expect the worst of it to hit about 4 months and then slowly taper down. So as that spreads throughout the country, each region is going to be hit differently. So it depends where you are. I know where I'm working in Missouri, we're just seeing the beginning of it. We're just starting to get the cases outside of Kansas City. So that means we have about 2 months of time before we expect it to really hit hard. So this is going to be a thing for the country as a whole for a long time. We can expect at least a few more weeks, if not a few more months. Some people are talking about this affecting the way we approach healthcare, handshakes, things like that for a long period of time, maybe years, maybe forever. I don't know. Something to keep in mind. Renee's asked me, is there a blood titer test they'd see if you already have COVID? I think all the tests are PCR, so they basically take a swab of your nose and they actually look to see if your nose, if the mucus in your nose has the protein of the virus in it to test you positive. So that's the answer to that. Linda asks, is it true that you should not take anything for a fever with this virus? As far as I know, that is not true. You can definitely take Tylenol for your fevers. In fact, that's what we recommend as a first line for any kind of flu infection or anything like this. So Tylenol is safe as long as you don't have a liver condition and it does affect your liver. Ibuprofen, there's a theoretical downside to it, but there's no scientific backing to that, so we don't really know. Could be harmful, could not be. Probably okay, hard to say for sure, but you can definitely take that. So we talked about supplements. We talked about steroids, vitamin D. I like vitamin D. Does it really help? Nobody really knows. Okay, here we go. I've got a lot of my medical friends looking, so if you have any medical questions, I can do my best to answer. Frankly, most of you guys are pretty smart. I don't know if I'm going to add anything. I can sort of talk about some of the things I'm seeing from the critical care standpoint, but yeah, most of us in the medical field are kind of on the same page, more or less. Been looking into it. All right. Here we go. So as we start to wrap up this session, one of the most important things that I want to talk about, we're going to get close. One of the most important things that I want to talk about are the discussions with end of life, right? So as a physician, this is one of the really difficult conversations that we get into, right? Is if somebody is dying, if we think they're dying, if they're elderly, what do we do and how do we approach it? So for those of you watching, I'm going to go into this quickly. I'm going to kind of approach it. I only have a little bit of time left, and I want to leave time for some questions at the end. After this, I'm going to make a full YouTube video that goes into detail about the things that you need to know about this. But I want to touch on this a little bit, right? So what we're seeing is, and we're potentially heading into, is a situation similar to that of Italy. And what happened in Italy is they simply didn't have enough resources or ventilators to provide access for everybody, which means that if you were past a certain age or had a certain level of frailty, should we say, that they weren't offering it to you at all. Now, for most of us in the healthcare field, this is basically a nightmare situation. Basically, you come in, your family member is dying, and we're telling you, sorry, there's nothing we can do. This is something that we're presented with on a regular basis, but still something that we don't want to have to deal with. But it's something that we need to talk about and be mindful of going forward, right? So myself as a physician, when I graduate medical school, we all take an oath, and the primary crux behind that is to do no harm. Now, that means a lot of things, right? So that can mean saving a life. Sometimes that can mean not saving a life. Sometimes that can mean making you as comfortable as possible and focusing on your goals and the things that you want as you progress to the end of your life and as you die, right? We're all human. Everybody that's human is going to die at some point. It's a reality we all have to face, something that we have to talk about. So this is the point where I encourage you to have that difficult conversation with your loved ones, right? With everybody you know. If they're at the point of dying, what do you want done? Do you want everything to be done? Do you want us to do CPR, chest compressions, potentially break ribs, provide that level of pain and uncertainty that you don't know? Do you want me to put a breathing tube in? Do you want to be on life support? These are very personal questions that you and your family members have to answer for yourselves. It's not something that I can ever tell you. It's not something that a doctor can tell you. And you have to know when you come to the emergency department, if you're dying, if you're unconscious, if things aren't working out, there are people that make those decisions for you. This usually ends up being family. Again, I'll break it down in my YouTube video as to the hierarchy of this, but you have to know that your family is going to make decisions for you. If they don't know your wishes, if they don't know what you want when you're there, they're not going to be able to make the right decision. The doctor's not going to be able to know. There are things out there called advanced directives. They can be helpful. They can help guide us. But ultimately, the person that's designated to make your decisions has the final say in most states and in the country. So you need to know, if you have a loved one, if you have a spouse, if you have children, be like, listen, if I'm dying and I don't want to be on a ventilator, do not put me on a ventilator. If we know that as physicians, we will do the best we can to honor your wishes and try and coincide with that. Again, there are a number of levels. There are things that we can do. We can not do CPR. We can just intubate you. We can not do anything. We can do comfort care. We can just treat with antibiotics. There's a lot of options there. And those are good conversations to even have with your doctor if you have the chance. But this is a reality that we may be facing as a country, that the people who otherwise might have been okay or had some options may not do well and may end up dying. So death is a conversation we need to have. We need to come to terms and come to grips with the fact that people could die. Death is a part of life, and we need to know how we want to approach it. So that's my opinion. Again, I'm going to go into more detail. I'm going to do that YouTube video as soon as I'm done with this, and I'll be posting it on my page. Stay tuned, pay attention, share it. I think it's really important. It's something that really sticks with me, and I think people need to know about. So, all right, we have a couple more things. I'm going to go for some other questions, and then once I'm done with these questions, we're going to kind of wrap it up. If you have anything else you want to ask me, now's your chance. Snooze, you lose. All right. So, Jerry, not take anything. Is it true that younger people are dying, says Ashley Lynn? So yeah, the answer is most recently the data and what we're seeing is, at least in the United States, we are seeing younger people getting the disease, getting critically ill, and put on life support, life-saving measures. This has gone everything from just being on a ventilator to also being on something called ECMO, which is basically when they put tubes in your legs, put things in your vessels that completely bypass your lungs and do your breathing for you. Now, I don't want everybody to be like, oh, I'm fine, they'll do the breathing for me. This is super, super end stage. A lot of people don't come off it. It's not a major turnaround condition. It's not something you want. We are seeing people in their 30s and 40s. To my understanding, there are still children who are 15 and younger do still seem to have protection. There are a couple newborn cases, but they're very rare. Most of the people actually in pregnancy seem to be doing pretty well. But we are seeing younger people that are sick and dying, including healthcare workers. I have anecdotal friend of a friend who's a resident out in New York, is in the ICU on ECMO. Healthcare workers, young ones like me, are getting sick and dying. Holy cow, please be paying attention to this. Rafaela, so she's asked me a couple things. So she's from Brazil, believe it or not, a friend of mine from ages past. She asked me two things so far. She said, how is our quarantine working? What are we doing? She's asking now, we were talking about cases and what we can support here in Brazil. So basically our quarantine is to avoid breakdown of our public healthcare system. So the same thing is happening in the United States. And essentially what we need to know is that currently the quarantine is not out there to prevent the total spread of disease. It's to decrease the time frame. So it's to stretch it out. If everybody gets the disease at the same time, goes to the hospital right now, healthcare systems are going to break down, we're going to run out of it, all of us are going to get sick, it won't exist. Then when you get into a car accident, and are there dying, we're going to be like, sorry, we can't help you. So it's a matter of sparing the healthcare system so that we can continue to do what we normally do. If the whole healthcare system gets overwhelmed, then deaths are going to increase everywhere in every situation, no matter what. So is our quarantine working? Our cases are still rising. It's still up for debate whether or not this is because testing has increased or because our overall number of cases are actually going up. I can say in my humble personal opinion, it sounds like our quarantines are not doing what they need to. We're in the United States. We hold our freedoms very dear, as we should. In places like China, South Korea, Russia, they put on quarantines that were so strict. I know that in Russia, I think it was a 5-year prison sentence were you to go outside after a 15-day quarantine. We don't do that. But those quarantines have been shown to work. They actually have a drop-off in the number of cases they have and decrease in mortality rate. So I'm not saying that we need to do that. I don't know the answer. There are people smarter than me and more specialized who need to answer that question. But it's a serious conversation we have to talk about. This also goes into some of the questions I've had is, does the government have the right to quarantine me? And the answer is yes. You need to understand that the Surgeon General has the right to take away your rights as they exist if it's in the interest of public health, right? So you can go back when Ebola was hitting. I believe it was a nurse in Texas was exposed to the disease, and they told her that she had to be on house arrest for 15 days and then force her back into her home. This was a Surgeon General warning. You can appeal this. There are things in place to make sure that you're not held totally against your will, but we can put temporary restrictions on you and may have to if it gets to that point, right? I know myself as a doctor, at any given time, if I'm working and if I deem you a hazard to yourself or others, I do have the ability to take away your rights. It's something that most people are confused on, but I can do it as a professional. So keep in mind that that does exist, and it's something we have to be mindful of. I see a bunch of my medical professionals watching. If there's anything you want to add, specific questions for me that you might not have seen, I know I've missed some things, please add in there. Most of this is directed towards my friends and family who are not in medicine, but I'm happy to have these conversations. All right, let's go back through. I'm almost out of my designated questions. I'm going to go through yours. Speak now or forever hold your peace. Jerry's asking me a bunch of questions. Oh man, we're getting really specific. Infection on the curtains and materials in each bay. So one of the things I've seen that has been somewhat comforting actually is that looking at the virus, it seems to not do well on things like cloth and hair. So anything that has anything that's porous whatsoever. Everything that's cloth actually has a lot of little places for the virus to get into. That's actually good. So if the virus is stuck in those little pores and on pet hair and things like that, it actually can't get out to infect you. The worst places that we found based on the research done by New England Journal of Medicine, published in New England Journal of Medicine, is that it likes solid surfaces like steel, plastic, it tends to hang out for a long time on. But things like curtains, anything that's porous or fabric, is actually a little bit better. I'm actually seeing things where people have been making masks out of the material used in surgery suites, which can be used once. Those actually, to me, seem like a good idea. If anyone's going to make masks and do things that are fabricated, I think that's the best way to do it because it's sterile, and we know that it does a good job of preventing those infections. So I think that is great, and I think that movement is good. Solid materials are good. That's also solid material is good. This also kind of dissuades. A lot of people were worried before about if you can get it from their pets, and that looks like it's much less likely. All right, so I'm going to slow down for a minute because I know I'm on a delay. Questions are coming in. Let's see what I can answer for people. Paula asks, how long can you battle fevers for at home before heading to the ER? This has been a tough question. Something I get a lot is, when do you come to the emergency department? It's a little bit of a hard one. I've had friends of the family ask me this and I'm like, man, it's hard to say. I would say fevers by themselves, remember, a fever really is not dangerous. A fever makes you feel terrible. A fever looks uncomfortable. It likes to scare people. But a fever is your body's response to an infection. And in fact, it's a pretty good one. We know that viruses and a lot of pathogens don't like a higher temperature. And it's your body increasing that temperature so that they don't work as well. So fever is actually a decent thing. Treating the fever with Tylenol can help. In fact, I'm one of those people who, if you come to the hospital or if you're in the ICU with a fever, I usually encourage people not to treat it because it doesn't hurt you unless it's in the realm of 105, 106, then it can affect your normal processes. 102, 103 doesn't really hurt you. It's not really dangerous. If it's steady for a long period of time and like for days, maybe it's a problem. Tylenol is a good way to bring that down. You can battle with that for a while. What we're really looking at is your ability to breathe and how much oxygen you're getting. So this is a hard thing, right? It's hard for you and I to know at home, what is our oxygen saturation like? How much oxygen is getting to our tissues going through our lungs? Unless you have a home oxygen measuring device, you're not going to know. So some of it's how much trouble are you having breathing, how hard does it feel, and are you really struggling to do the normal things? The other thing to pay attention to is dehydration. So what kills people is not being able to breathe and dehydration. If you aren't able to get fluids in, if you're throwing up, if you are having lots of diarrhea, those are the things that are going to lead you to being dehydrated, and that dehydration is what ends up leading to mortality, and because your body can't function normally, gets so dehydrated you die. So those are the things to be paying attention to. So you can deal with this. Most of the symptoms, most people are going to be able to deal with this at home. Take your normal stuff. If you're really struggling, call your doctor. Maybe you can get a prescription for things like Zofran, Tessalon pearls to help with those symptoms. Do the best you can to deal with it at home. Stay away from me. I'm kidding, I love you. I want to see you in the ER, but only if you feel like you need to. Keep everybody else safe and try not to get everybody else sick. All right, coming back through it. Let's do some of these other questions. You can see me do my white boy moves in the meantime. Claudia asked, liver compromise. You can extrapolate on that question. Dariana asks, if a loved one has to go to the hospital, they have to go alone. So this is going to actually hospital. They're all having different policies. Some are doing things where they're giving you a mask and doing PPE and they have one visitor. I'm a proponent of that. I think as long as you're trying to keep yourself safe and not infecting other people, if you know somebody that's really sick, like they're going to go to the ICU, I believe in the human component of it. I want somebody to be there. I think having a loved one there is important. A lot of hospitals that were initially saying nobody could visit, this was in births, this was in ICU cases, they're kind of backing down on that because they're realizing the human component is really important. I know there were friends that I had that were worried fathers were they weren't going to be able to be there for their child's birth. And I get it. That might be the situation we're getting into, but that's crazy. And that tells you the situation we're in. Most places I know think they'll have one visitor, but they limit to one visitor for the whole time. There are hospitals that are saying that you can't come in. It's a judgment call. It depends how sick. I think that if someone's a little bit sick and you think they're going to get better, then it's probably better if they go by themselves. Couple more questions and we're going to end this. We're getting close to an hour and I have another video I want to put for you guys. So let's see. Thank you so much. You're welcome, Debbie. I hope you appreciated this. What makes the virus so different? What's bringing it into the cells? So the specific thing with this virus is we think that it's related to the SARS virus and it likes to has an affinity for certain receptors. It's the ACE2 receptor, and they're found on specific cells in your body, specifically found on the vessel cells in your heart, found in the cells at the bottom of your lungs, found in your kidney and your liver. So this is where the virus likes to infect, and this is where it affects. So somebody else asked me, does it affect your liver? And it can. We are seeing that it tends to cause more problems with your heart and your lungs, but liver, kidney can also be infected. The other thing that makes this different, part of it is the fact that it's silent. A lot of people end up being asymptomatic or only having mild disease. With things like SARS, H1N1, a lot of people, by the time that you were shedding it and sharing it to other people, you were super sick. And then we can say, hey, he's sick, he has it, get him out of here. Part of the problem with this virus is it spreads so silently. So a lot of people are getting it and spreading it without knowing that they ever had it. So that's one of the big things. Those are the two big things that are changing it. As I said before, we have to realize that at this point, this virus is found to be 10 times more deadly than the flu virus. That could change as data comes in, but it's not yet. We are seeing people die at a higher rate. Ask the people in the ICUs, ask the ER doctors that are in places like New Orleans that are in the epicenter. Ask them. It's more significant. Pay attention. One or two more things. So we said it can travel or triple. That's true. Last one, Raphael's asked, vomiting and diarrhea are conditions. So you can get vomiting and diarrhea with this virus. It is less common. They're saying the reports from China, if you want to believe them or not, are saying about 20% of people with the virus do have GI symptoms. That's vomiting and diarrhea. So that it is common. It changes person to person, but if you're only having that, doesn't mean you don't have it. That's why we're saying anything at all that's like the flu, you have to take seriously. You have to say, I have it until proven otherwise. All right, guys, I know I speak quickly. If there's anything you want me to go back over again, let me know. Questions for me, got about 3 minutes. Like I said, another YouTube video is going to come. I'm going to try and do these Q&As weekly. We're going to do different topics. I'm going to do general things, life in the ER, chest pain, things like that, topics I want to talk about. We'll do some general updates. They're going to be much shorter, probably limited to about half an hour, but just some updates from the field. Wish me luck. I go back into the trenches on Tuesday. I'll be like getting into that particular hospital I'm working at is just starting to, so we're going to see how it goes and how crazy it gets. Hopefully we'll getting live updates there. Last minute questions are there. Otherwise, stay tuned. My YouTube video going over everything you and your family needs to know about end-of-life decisions, goals of care, things that we want to talk about. That's going to be coming in a YouTube video shortly to follow this. I love you all. Stay safe. You're all amazing. Hope everyone's doing well. Yeah. Love you. Take care. Be safe. Adios.